me, can you?
Good afternoon. My name is Ann Brasso. I'm the owner and founder of MPN Advocacy and Education International. Today, we're going to bring back Justin Grinnell, who is a fitness trainer. Today, he's going to talk about moderate exercise and some really great points that you can pretty much create your own program. And I'm going to turn this over to Justin, as we only have one half hour today. And Justin, thank you so much for joining us.
Yeah, of course, Ann. It's a pleasure. And you caught me in my Superman suit. Not really Superman, but
yes, you are.
Well, thank you. We had 4 days in a row of all these different costumes, so I'm being a good boss and
happy Halloween.
But, yeah, it's happy Halloween. So thanks again for everybody joining today. I hope I can give you guys some really just get you thinking and good insight on what you should do for exercise. In the exercise world, there's a few things we really need to address for all of us, regardless of age or our fitness level or anything. We just take them in different doses as far as intensity. I want you to think of 3 different blocks when you're creating a workout. And last time that I was on, if you joined us, I did mostly like the mobility section, stuff just to get you moving, even if it's as simple as sitting there, at your desk and you're doing some head nods so you don't get all this neck tension. That's really important. Or I call it open and close, getting these shoulder blade muscles working, just because, again, we're so forward. Anything to get you some just small micro doses of movement is going to be some of the best things you can do for your body, because it likes them in little doses frequently over a given period of time. So that was the first part we did. And I just kind of did that almost in a living room setting. So now I'm going to show you guys more about what you do for a full workout. And pardon, I'm going to send some PDF follow-ups, but pardon my my writing. It's not the best, but maybe you guys can see it a little bit. And mobility. Why do we do mobility? All right, everybody needs to do it, especially as we age, especially because we know with some of the MPN patients, blood flow is so important. Is we increase tissue temperature and increase blood flow. So today I'm dealing with a little hip issue, and I knew right away if I got on the bike and got some blood flow, I stretched it out and I increased my tissue temperature, I'm going to feel better. Okay, you're generally just going to feel better when you do that. We can do that with different warm-up drills, which we'll talk about, or you can even do it with just some light cardiovascular exercise or a walk, anything to get that moving. Even a foam roller would be good if you're going to do some massage. We need enhanced mobility. What does that mean? We need to put our joints through proper ranges of motion. Now, this maybe sounds kind of funny, but a lot of us can't really raise our arms above our head properly. We want to be able to do that. Okay, that's going to give us good shoulder health, good neck health. If we get here, we can't. Well, we know we need to work on enhancing the mobility of our shoulder somehow. Okay, or if we can't get up and down off the ground, things like that. One thing we also need to do, if you see this word, is muscle activation. We need to activate key muscles. And I'm going to show you something that's a really good tool for everybody, is a hip band. So they look different depending on what band you get, but they all work really the same. This is a hip band. All right, this little guy here, you get like $2 or $3 on performbetter.com. There's various levels of the band. You might see another band that is like this. Now, why am I saying hip activation is so important? Because I'm going to bring my camera down. All the muscles in our pelvis are super, super important. There's so many things going on in our hips, and especially for us young ladies, we've got to make sure all these muscles are firing. So I'm going to just put this band on real quick. And this would be an example of activation where you simply just put a band around your knees, your shins, and so forth. If you guys can see me a little bit better here, I'll move some things. And you're simply just do some walks, okay? You're just doing some walks to get these lateral hip muscles activated. And a lot of this is important because low back pain. The more we can activate our hip muscles, our tummy muscles, and our upper back muscles, the better our posture is going to be, the better our lower back is going to feel, okay? And so that's why muscle activation is so important. As we age or as other factors come into play, they don't work as well, all right? And so we've got to literally turn them on like a light switch, and so our brain makes that connection. So that's some of the muscle activation. Now we've got to get our nervous system working, okay? Well, what does that mean, okay? Well, if you've ever been like scared, whoa, like on Halloween, right? It kind of wakes you up a little bit. That's your nervous system responding. And you can do that with exercise as well. And we do it with all age ranges and abilities. It's like throwing medicine balls. And those are things to really keep power development. Well, why is that important? Well, as we age, we lose the ability to produce power 4 to 5 times faster than strength. So like throwing a baseball or, sprinting, okay, we lose that ability. So we can do simple things to get that nervous system fired up, and so that we can keep moving fast as best we can. And then movement practice. What does that mean? Well, 2 things I want you guys to remember forever. There's 2 things you want to always be able to do for the rest of your life is get up and down off the ground, pretty easily, and then squatting down. All right, these are 2 huge things that are just fundamental patterns that we'll do. We'll do various up-down drills to get up and down off the ground, or of course, I move my screen, various type of squats, or can we sit in this type of squat pattern position? So practicing everyday movements in the workout. Okay, and that's part of the warm-up. So what could that look like? Well, I showed you the band. Okay, I showed you the band. We'd walk that for some muscle activation. We would simply do something like this, and you're like, oh, wow, I hate getting up and down off the ground. Well, it's pretty important. We'll do some things where we'll just have you get up and down off the ground and then come back down. Simple as that, okay? To get us moving, we'll do some squats. So between that and doing some different squats, that's gonna help us get going. One thing I like to do for a warm up for that muscle activation is if you grab, a different type of band. I've got all types of bands here. It could be one with handles. It could be one that doesn't have handles, a TheraBand from your therapist, whatever it is. But one of my favorite drills, because we've talked about us, doing the open and close or the up and down head nod stuff. That's going to be good stuff at our desk, but this is going to be more for strength to activate those upper back muscles, the foundations in the upper back. And so you're going to wrap a band, keep your arms totally straight, and keep your head back, and you're going to pull, squeeze your shoulder blades, and then come together. When you come together, you don't want to lose tension. So you can really get any band you want, and you can make it a harder tension for less reps, or you can do it light, and you can go 50, 60 reps, because again, muscle activation, we're trying to get them active, okay? So just doing that wide pull is one of my favorite activation drills. I know I'm throwing a lot of stuff at you guys, but again, I'm getting you guys thinking, and I'll send a follow-up for like a mobility type circuit that you can do. So we had the band walks, we had those pull aparts, okay, getting up down off the ground and a squat. Now, if you remember some of the things from last time, I'm going to get on the ground here so you guys can see me a little bit better. And some other mobility drills that are, not as tough. I mean, it looks so funny in my costume here, but I think I'm getting used to it. Is the first one is we're going to enhance some mobility here and get some tissue temperature up to just a basic cat-cow. So you're going to go here, arch and pinch the shoulder blades, and then round. So big, round, big mad cat. This is good for anybody, any level. We do this with everybody. It gets the spine moving, and also gets us thinking about spinal position, okay? And then we'll go to something a little bit more balance-based. And when we do this one, it's called opposite arm leg reach. You're going to reach the right arm and left leg. You're going to pause, and you're going to pretend like you have a cup of coffee on your lower back. You're going to reach the arm out in front of you, leg behind you, and squeeze. We're going to go 5 of those each side. And of course, we have to switch to the other side, taking your time. So maybe starting with some head nods, that cat-cow, and then going into that opposite arm leg reach. Then we transfer into what's called a Spider-Man. So if you can see, my cape's kind of blocking me here, my legs here. Again, this is something that most people can get into. Just stretch out your hip, both front and back side. So enhancing that mobility of the hip. And then we're going to rotate. And we'll come back down, kind of get deeper into it. And then rotate again, pause. And then come back down. And typically for all these, we're thinking 5 to 10 reps, okay? 5 to 10 reps, depending on how you're feeling. If you started out, did some of the cat-cows, did the opposite arm leg reach, we did that little Spider-Man rotation, got up and down off the ground a little bit, and then you stood up, got some squats, some band walks and those pull aparts, those two things they do with the band, that's a full mobility-based warm-up. And that's something that you should try to do, every day if you can, just to feel good. But it helps us get ready for the strength, okay? So we're thinking about strength training. We can think about, all hundreds of muscle groups we have. We have so many different muscles, but how do we get the most bang for the buck? We need to, the goal of strength training is work as much muscle tissue as possible in one movement. And really, you can think of any exercise, whether hard or easy, as a full body movement, all right? And we can do so many different movements in each category, but I'm gonna show you guys a couple things here. So I was gonna write, but maybe I won't. So push. So we're thinking of push. When you think of a push, okay, for strength training, most of us will think of like a bench press, right? Or a push-up, or like an overhead press. Those are kind of the basic pushes, but we all need to push in some way. So we can do modified push-ups. We can do some type of overhead press. I'm gonna show you two different pushes that I like to do that you could do with almost anything, anywhere. And the first one is just an overhead press. And you could take literally small dumbbells, big dumbbells, whatever you have. Just kind of think about this. If you don't want to do a lot of heavy weight, just do more reps. It gets a good work in. We do want to try to stay under 15, 20 because we want to get an adaptation with the muscle tissue in the bone. But, it depends on what you have. Something's better than nothing. And this is what's called a shoulder press, real simple stuff. So typically we stand, all right? But what I would rather have you do, because I don't want you to do this, arch your back like this, is I'm gonna bring this down here again, okay? I don't have a cameraman today. And I want you to go on one knee to do that press. And again, you don't even have to use dumbbells. You can use anything you can press over your head. And I want you to go on one knee right here. So getting on this one knee gives us more support in our core, safer on our lower back, easier to press. Sort of bring those dumbbells here. I'm gonna show you from this side. We're gonna press my biceps in line with my ears, and I come back down. Simple as that, but the key thing is tightening the core. I'll show you a front view here. So again, I bring the dumbbells here, press, and come back down. Traditionally, we want to try to stay between 6 and 12 reps, but you can. You'll play around with that. So that's one of the pushes. That we can find anything to put over our head. That's where you need to get stronger. We talked about the overhead mobility. Push-up. Now, push-ups are tough. If you can do 5 solid push-ups, I mean, that's pretty darn good, okay? That's a pretty good, base right there. But you can start with just going into a push-up position. If a push-up's too hard, you can do just a push-up plank, okay? And then you're still working your core and push-up muscles. Maybe that's all you could do right now. And that's fine. Start there. Try to hold it for 30 seconds to a minute. And then when you feel like, I'm ready to do a push-up, we can go on our knees. You probably can't see because of my cape there. But you can go on the knees. As long as you keep the core, the glutes, and everything locked in, maybe you can start there, okay? Or, you're like, I'm ready for a real one, full one. Just lower yourself slowly, leaning forward, elbows in. You're here, and just kind of cheat up, okay? So there's some pushing exercises that you could do that you do anywhere. Then we also have next, we have the pulls, okay? Pull, I want you to remember this, pull is more important than push. Well, why is that? Because we want to work our back muscles more. Because posture, there's a lot more muscles, we're usually tighter here. So let's see if I can show you guys this. I'm gonna take this band, and if you can buy these bands with handles, relatively inexpensive. A door jamb around maybe a pole or something. I have this attached to something right now, guys. And all I'm gonna do is I'm gonna step back right here. I'm gonna do a row. You're gonna pull things towards you. I put 1 foot forward, 1 foot back, nice and tall body. Put my shoulder blades together, pause. I want to get my arms right to the side where they're parallel with my body, and then come forward. Lift the chest, pinch shoulder blades, and then come forward. Now, if you see me, I don't want to pull like this, okay? Make sure when you pull, arms on to the side right here in line with your body, then forward. So you can do some type of row motion. You also have another thing you can do. You can take a dumbbell, kettlebell, again, anything of substantial weight. During the pandemic, we were having people using bowling ball bags, all types of stuff. And you're getting this, I like this little stride stance, again, my cape here, arms here. This is a one-arm dumbbell row or a one-arm row. Same concept, you're just in this bent over position. You get a little bit of leg work here because you have to stabilize with the legs. You're using your thigh, it's kind of a helper here. You're doing a one-arm dumbbell row. So those two pulls are ones that I would recommend for strength training. You just have to pick one per workout. So I can explain a little better. One from each category for the mobility, then we think one from each category of the strength. Now we're thinking hip. Well, what does hip mean? Well, let's go just with a basic hip exercise that I think everybody needs is a hip lift. It's real simple, guys. And you can do a lot of these. In fact, more reps, the better. And we're right here. We can do double leg or single leg. So if you see me here, my feet are just like this, okay? And what I want you to think about is think of your ribs down to your pelvis are connected. And you want to keep those engaged. Now, when you go up, you're going to squeeze and you should feel a stretch in your hip flexors. People talk about hip flexors being tight. This is a better stretch for your hips because it activates the back side, loosens the front side, but it also strengthens the back side. So you're going to go up, you'll squeeze, hold, and come down real slow. I think you can ramp it up to 10 to 20 reps. Now, if you get to a point where like, you know what, I'm pretty good at those. You can go one leg because you want to try to create some symmetry. You just hug that knee in towards the chest, foot flexed, arms at your side. You'll lift up, pause, come back down with control, and repeat. So all reps you should think of being controlled. And of course, we do the other side as well. So I would start there for the hip. And then for the squat, you can just do a body weight squat. And you can even do an assisted squat. You're like, you know what? I don't feel strong enough to do that. I don't feel like I know how to do it. That's fine. This is one you should do at your desk anyway if you're working and things like that. Just find a desk and you just butt back, weight in the heels, keep your knees and toes straight ahead, keep your spine straight, and then come back up. That's kind of where it starts. And then, of course, we can do a body weight. And if you want to up it, whether you're using kettlebell right here or a dumbbell, we can add resistance to it and do what's called a goblet squat, where you hold that dumbbell or kettlebell here. Not only does it give us weight, it makes our postural muscles work well, and also our core muscles. So again, for the squat, you're just thinking weight in the heels, chest up, and sit down in your seat, keeping those knees and toes straight ahead, okay? That's the squat pattern. Well, once you think, well, I'm getting pretty good at that, I want to do something a little more challenging. That's not a problem. Go into a split squat. So what that's going to do is you remember the half kneel position I was just in, where I'm on one knee, okay, relatively 90-degree angles with my legs here, okay? And again, we can hold weight here, okay? We can hold weight at the sides. We can do no weight. These are tough with no weight. In fact, we could even do a couple things like, you know what, I'm not ready for that one, but I want to get better on one leg and get some balance in my legs. You grab some pillows or pads and you can make it even higher. So your range of motion is reduced. All right, so you can maybe start there. And you're just doing this split squat here. Okay, for that squat family. And then maybe you're better at it, so you keep going lower. Eventually, you know, you're making it a little bit harder. So you do that split squat position. So those are two different squats that I would recommend. Now we get to the core. All right, we have so many things that we can do for the core. Literally dozens and dozens and dozens. Here's what I want you to think about. When you think about the core, it's about resisting motion. Well, what do I mean by that? Well, let's just say, I mean, I know none of us are probably playing football these days, but let's just say you're pushing somebody like this. They have to resist that, okay? Or if we're bracing for something, or even something as simple as trying to pick up something, we're still resisting something. If I need to grab that, I need to be able to engage. So if you guys want to do this with me, I want you to stand up real tall and get your legs all the way together, okay? And what you're going to do is I want you to squeeze your inner thighs together and squeeze your quadriceps. Then I want you to take your pelvis and kind of push it forward to where you can squeeze your glutes, okay? Then I want you to take a big deep breath and then push your ribs down and squeeze your tummy like someone's going to hit you. Hopefully no one is. And then you're going to squeeze your fists, get your chest up tall, and squeeze your shoulder blades. So think of this as a pencil dive, okay? Essentially, you're trying to resist rotation with tension. And so what we need to think about is just a simple plank. Okay, we can see a simple plank is going to transfer for everything with the core. If we can get that really well, and again, think of a plank of quality, not quantity. If you're holding it for more than 30 seconds to a minute, you're kind of just, I don't know if you're wasting time, but you're putting too much time into something you just need a lot of effort with. Okay, so think of resisting, or if some, we've done a lot of exercises where people have, where you take this dumbbell, you don't want to do this, okay? Now it feels good, and it feels like we're working that muscle, but this muscle right here, quadriceps oblique, it's supposed to resist lateral flexion, exactly this. So think of a suitcase that you have. It's actually a suitcase carry, which the core leads right into, right here, the carry. And this is an important one because you want to have your body's ability to carry weight around, okay? Which is important. So if you want to work your core here, laterally, you put any weight in your side here. And now I've got an offset load, right? And it could pull me this way. Well, I don't want that to happen. I want to pull that here, keep the body steady. Now you have two options here. You can literally just walk around your basement with tall posture, walking evenly, balancing a book on top of your head. If you do that long enough with enough weight, you will feel your muscles get a lot stronger in your hips and core, and you'll feel them sore the next day. Or if you're like, you know what, I'm not going to be silly and walk around my house here, my basement or whatever. For those who are looking to help balance, we can work our core here. Most people need like 20 plus pounds here in one hand, and you're going to do a little march. So here we're working our hip flexors, our single leg balance, and our core. Okay. So you're just grabbing weight, super tall posture. See, I fumbled on that one there. Pause, 1, 2. Maybe I do 5 to 10 reps there. And I have 5 to 10 reps here. Okay. That's a tough one for my core. So I get my hips, I get mobility. If I want to have what's we call a farmer's carry, we're going to have two weights in each hand, nice and tall. Again, think of that plank position. Think of all those tension points I talked about: thighs, glutes, abdominals, upper back. And then you could also either walk. I'm going to show you the march since I'm right here. So this is kind of core / carry. I may get the question about sit-ups and crunches. Well, I mean, I hate to say any exercise is worthless, but you're not really spending time in the right spot. That's all I would say. You need stability. Okay. So in review, before I go on, and I know I have some questions because I'm trying to pack a lot in. That's why I want to follow up. We need 3 things for exercise. Everybody, anybody, doesn't matter. We need to be mobile. We need to be able to move well. Okay. We can practice these things daily, from the head nods I showed you, to the harder stuff. We always need to make sure in a day we increase our tissue temperature and to enhance our blood flow. Okay. Very important for you guys. Enhance mobility by just moving our joints through full ranges of motion. Okay. We need to activate certain muscles, in particular the hips, okay, which could be that hip lift I showed you, the core, which could basically be just a plank, and also upper back. And I showed you the easy one where we opened and closed. The one I'd like a lot of you guys to do, because we all can find some type of band, is some folks that have some posture issues, neck issues. I have them do 100 of these a day because we want these muscles active so that when we're driving and eating and working, those posture muscles can keep our spine upright. When I get the nervous system working, what does that really mean? We're just doing something active. You want to excite that nervous system, whether it's throwing a ball, whether it's just doing some jumping jacks, whatever we can do. And then movement practice. The 2 things I want you to remember, because we could talk about all types of movements, is can I squat well? Maybe it's with assistance, that's okay. And can I get up and down off the ground well? Those are 2 big measures of quality mobility, okay? Then we go to our strength. We can get you guys a routine. Now, we could say bicep, tricep, shoulder, back. I mean, there's so many things we could do, but we want to think bang for the buck so we can get everything. And these movements, you can get everything. Push. So push-ups, maybe a chest press, a shoulder press with anything. Okay, pick one of those. A pull. Okay, so I showed you the band where you're pulling here. You can even count that band pull apart I showed you. but I also showed you the one-arm dumbbell kettlebell row. That's a good option. The hip. So I gave you guys, want to start with just the hip lift. I would start there because we can do deadlifts and things like that, but the hip lifts are always going to be good. You can even add weight by putting it on your waistline. Quad, you can't really see it. A little bad D right there, but squatting. Okay, we need to be able to squat with resistance if we can, whether that's, you know, a bodyweight squat assisted, the goblet squat, that's gonna be your fundamental base, okay? Squatting with that. But if you can, because we walk and we're always on one leg, we need to be able to do this split squat, okay? Or even better, if we can do some lunges, okay? Because you're resisting ground reaction force. And if we're walking, we're doing that on a daily basis. And so we need to get ready for that. And then the core, what I want you to remember about this is resisting rotation, resisting extension, like arching your back. Okay, you don't want to do that. And you don't want to resist to the side. Okay, we can start with some basic planks and so forth. But what I wanted to go into more, I think I'll give you a better concept, is the core carry combo. I want to show you guys that one more time because it's so simple, but gives such good results. Grab a weight. I mean, you can literally grab a suitcase or anything of substance, put it in your hand, super, super tall posture, bracing the body like you're ready for some impact and doing these marches. The offset load is going to be harder. If I hold, let's say 50 pounds in one hand, all right, and it's only one hand, you think, okay, well, if I had 50 pounds in each hand, it's actually be harder for the single side, you have a counterbalance. But you want to do a combination of some of the farmers walks or carries where you have weights in each hand that are somewhat even, or the singular one. And between that and a plank, you get your core started. All right, we're almost there. So, and I want to answer some questions, but I'm going to share my screen real fast here because the third part is cardiovascular conditioning. Okay, and this is something we have to address. And this is something as I age, I'm thinking about it more. Okay, and because I want to make sure my heart can eccentrically and concentrically contract really well. It pulls blood in and pushes blood out. Now, the high intensity exercise, that's great. I mean, we want a little bit of dose that. We want our body to be ready for that. But really where our cardiovascular system really wants to get the training is at this moderate intensity at a RP, which is a rating of perceived exertion, at about a 6, okay, maybe a 7. So you're working, but you can keep a conversation. If someone came to you and you're on the bike, say your son, daughter, whoever, hey, I need this, I need that. And you could say back to them, oh yeah, it's in the, the cupboard upstairs, this, that, and the other. Give them a couple sentences, maybe take a break, take a breath, and go again. So it doesn't have to be that hard. For most people, okay, you're gonna be between 110, 120 beats a minute, maybe up to 140, 150 beats a minute. You can track that on any gadget, and it could be any modality of cardio that you like. Bike, it could be a walking, treadmill, doesn't matter. But here's the things I want you guys to remember, because these are important right here. Okay, so indicators, some KPIs, resting heart rate, and this will vary for some of us. So these are just things to look at. Below 65 beats per minute. If we want to improve our cardiovascular system, our fitness, our health, we want to try to get a good BPM, a resting heart rate, below 65 if we can help it. Again, some people have medications, things like that affect that, but it gives you an idea of how well your cardiovascular system, how efficient it's working, okay? And this can be tracked with any gadget. I do it with my Apple Watch. Heart rate variability, okay? Heart rate variability, HRVs. This is one that, like I believe the Aura Ring, the Whoop Strap, a couple other ones will keep track of for you. Okay, if you look at the broad marker of your abilities to tolerate stress. So when it gives you that stress marker, if you use any of these gadgets, this is one thing that's going to base it off of, okay? If it's improving, you see gradual increase in your heart rate variability. Okay, so if it's increasing, good things are happening. And this is another one, again, keep in mind some of these will vary from person to person. 60-second heart rate recovery, okay? So let's just say you go on a bike and you sprint. Let's just say you get up to 150 beats a minute, okay? Measure how fast your heart rate drops in the first 60 seconds of the rest period. As your conditioning improves, your heart rate should drop faster. So say it's 150, that's the top one that you get, 150 beats a minute. In 60 seconds, we go down at least 25 to 30 beats in that minute, good. If we're getting above 30 beats a minute, meaning in that minute rest, you went from 150 to say 120 or less, pretty good recovery. Because it's not only about how hard you're working, can my body recover from all that stress? And again, that's going to be something that a lot of us deal with differently. But really, if you just get on a bike or walk, and you're just getting some consistent heart rate increase, small doses over time, that's really going to help all these markers right there, as well as if you go to some high intensity ones. But again, depends on the person, depends on what you can do. All right, well, I think I got it on 12:30. I tried my best here, Ann. How are we doing?
You did a great job. You did an excellent job. And
All right.
I can't thank you enough. You really brought it from where a person can start and how they can build their own program. And again, we're getting lots of applauses here. So I really appreciate your time, Justin, and hope to see you real soon this week. And we'll have you back again, I'm sure, because we're going to do this series. And I really appreciate it, though, because you do this for free. And it's just so delightful to have you with us.
Of course, my pleasure. One thing we could do, and this is to the crowd too, is
Yeah.
try some of this stuff out, get some questions gathered. It'd be good to have a little Q&A, or whether you read it in the media, whether you tried it on your own, whether whatever the case may be, we can have a talk shop and really get into some things that maybe will help. I want to deliver some of the information that you guys are looking for.
Exactly. And he's absolutely right. If you have questions, please send them along and we can get those to him immediately and he'll respond. But thanks again. And we'll have you back soon and I'll see you soon.
All right. Well, thanks for dealing with my beautiful costume today.
Yeah, Superman. See you, Clark.
All right. See you guys.
Bye.
Bye.